everybody. I'm Brittany Lewis. I am a breaking news reporter here at Forbes. Joining me now is Alex Knapp. He is my colleague covering healthcare and science here at Forbes. Alex, thanks so much for joining me.
Always great to be here, Britt.
There is certainly a lot going on in your beat within really the past 24, 48 hours, and I would love if you could make sense of it for us. There has been a staffing shakeup at the CDC this week. Late on Wednesday night, the White House announced it fired Dr. Susan Monarez. She was the CDC director. And then really that was a catalyst for a flurry of resignations of other top leaders at the CDC. To start off the conversation, can you give us a rough timeline of what exactly happened?
So based on the reports that we have right now, a few days ago, it looks like Robert F. Kennedy reached out to Susan Monarez and asked her to fire several high-ranking members of the CDC. And Susan Monarez refused to do so, saying basically that there was no cause to fire them. And as a result, she didn't believe that it would be justified to. And apparently also went to Senator Bill Cassidy, who is the chairman of the Senate Health Committee, which does oversight of HHS, and mentioned this to him, who apparently also then took this to Robert F. Kennedy and complained about it. And this apparently incensed Robert F. Kennedy, and he ended up saying that Susan Monarez was fired. Susan Monarez did not resign. And in fact, her lawyers are saying that HHS did not have the legal authority to fire her because she was appointed by the president and confirmed by the Senate. The White House then said a few hours later that yes, she is fired, but her lawyers have again pushed back against the legality of that, saying until Donald Trump fires her, she is still serving as CDC director.
And then after that, like we said, that was a catalyst for a few other leaders to resign as well. But Dr. Monarez, she was sworn in as the CDC director July 31st. Right now, it is less than a month that she's been on the job. As someone who has covered healthcare for years, how unprecedented is this?
I can't really think of anything like it except for an earlier move a few months ago by HHS Secretary Robert F. Kennedy Jr. when he summarily fired all 17 members of the CDC's Advisory Committee on Immunization Practices, which makes recommendations about which vaccines to get. That was equally unprecedented. We're also seeing, within the CDC and HHS at large, like we're seeing in the rest of the federal government, a lot of large-scale layoffs, which the courts went ahead. They were challenged, but the courts said that the firings could move ahead. There have been, buyouts and other things. So there's definitely a smaller staff among the CDC generally. But when we're talking leadership like this, it's pretty rare to see a shakeup of this magnitude. Once Susan Monarez was let go, or at least tried to be let go, we'll see how the legality of that shakes out and how President Trump responds. 4 senior leaders of the CDC resigned in protest and solidarity, and they were escorted out of the CDC about an hour or so ago at the time we're recording this.
And Monarez's attorney did not mince words in a statement that he released. I want to read it in part because in it he accuses HHS Secretary Robert F. Kennedy Jr. of, quote, weaponizing public health for political gain and putting millions of American lives at risk. He also adds this, quote, when CDC Director Susan Monarez refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. What do you make of that statement?
I think it's definitely of a piece with what we've seen from Secretary Kennedy during his tenure at HHS. Kennedy has a lot of I just flatly say false scientific beliefs. On Fox and Friends this morning, he shared his disdain for the CDC and its promotion of water fluoridation, which is a well-established scientific health measure, as well as vaccinations, which he has been an anti-vaccine advocate for a very long time, although he'll claim he's not. But in practice, he obviously very much has been. And, you've definitely seen a lot of senior leaders at FDA and HHS who resign often in protest of what they say is being forced to commit to policies that they don't believe have a scientific basis. And this is just part and parcel of how Secretary Kennedy has run the agency.
And White House spokesperson said this, quote, as her attorney's statement makes abundantly clear, Susan Monarez is not aligned with the president's agenda of making America healthy again. Based on these moves, paired with the new vaccine guidelines that we haven't even gotten into yet, I mean, what do you think that really looks like, their version of making America healthy again? Because you have the CDC director saying that essentially the agency's politicized. You have other resignations, and in those resignations saying we can't move along with the CDC the way it's being run now. In some instances, they feel that it's also politicized. I mean, what do you make of where the administration and where the CDC is exactly going?
I think that it's a particularly dangerous moment for American health and American healthcare. What we're seeing is policy decisions being based not on evidence, not on scientific understanding, but rather an ideological perspective of Secretary Kennedy's that is rooted. If you read one of his books, which is published in 2021, he actually calls into question whether germ theory is real and whether pathogens actually cause disease. And this is the person in charge of public health. And this is at a time when we're facing a large number of health challenges. Climate change is causing more mosquito-borne and tick-based diseases to spread in the United States. We're facing the very real risk that avian flu is able to transfer to human beings and spread that way, which could cause a great deal of catastrophe. We're facing a mutated strain of Mpox, which is spreading faster than previous strains. And although we haven't seen a lot of it in the United States, it is spreading in Africa and is definitely a real concern. So we're facing very real threats from infectious disease, and not to mention chronic diseases that Secretary Kennedy, because of his ideology, simply isn't equipped to handle and is leading America down a path where we're not going to be able to respond effectively to these concerns. As we saw in Texas, when his response to a measles outbreak was to recommend vitamin A instead of vaccinations.
Is there a sense of who exactly RFK Jr. is consulting with, or where he's getting his data or anything like that? Because the head of the CDC's National Center for Immunization and Respiratory Diseases, he resigned. He was one of those top leaders who resigned. And this is what he said in part, quote, "We are 7 months into the new administration, and no CDC subject matter expert from my center has ever briefed the secretary. I'm not sure who the secretary is listening to, but it is quite certainly not to us." Then who is the secretary listening to? Do you have any reporting, any insight on that?
Sure. I mean, Secretary Kennedy surrounded himself with a number of people who are anti-vaccine crusaders, who one of whom he recently put in charge of a task force to look at COVID vaccine safety. He's been working with a number of wellness influencers who promote theories of health and wellness that aren't rooted in any kind of real science. We kind of saw this. There was this really bizarre episode on Twitter a couple of weeks ago where a study came out, and it was a study about diabetics and can diabetics safely eat potatoes, which is actually an interesting question because they're very carbohydrate rich food, and do they cause issues for diabetics? Study found that for the most part, you can prepare potatoes in a number of ways, and it's safe for diabetics to eat, with one caveat being that diabetics should avoid French fries. And to this study, which I think is seemingly uncontroversial, that French fries are not the healthiest food in the world, right? And this study was pretty clear that potatoes prepared this way are not healthy for diabetics. HHS had a thread of tweets complaining that the real issue wasn't the French fries, it was the seed oils. And if we use beef tallow instead of seed oils, then it would be perfectly fine for anybody to eat, which is absurd on a number of reasons. But I think the most bizarre thing is, why is an official government account responding to a study in this way? And why are we, in the name of making America healthy again, promoting eating French fries? That's, I love fries as much as the next person, but I eat them in moderation because they're not that great for you. They taste delicious, and that's because they are deep fried in oil. And it doesn't matter what kind of oil you fry it in, it's not going to be a healthy food. But this is the type of kind of conspiratorial thinking where you just kind of latch onto these little obsessions. And it's really rooted in a lot of the health and wellness influencers in kind of the greater MAGA movement. Right before I went on to record this interview, I went to Donald Trump's Truth Social page to see if he had officially fired Monarez yet. And there wasn't any statement, but there were a lot of ads for ivermectin, which is an anti-parasitic drug that has become like this catch-all wonderful drug for people in the MAHA movement, being prescribed for a lot of diseases that is simply not effective for, because it's seen as this kind of magic bullet against COVID and a number of other things. It's not. If you have parasites, ivermectin is a great drug. If you have cancer or COVID, don't take ivermectin. It's as simple as that. But this is the kind of ideology that we're seeing influence Secretary Kennedy's policy decisions.
To the point about the French fries and looking at the data a different way, one of the CDC leaders who resigned said that he's never, quote, seen such unskilled manipulation of data to achieve a political end rather than the good of the American people. And I have a page full of quotes from leaders who are now out of the CDC that say essentially the same thing, that they have seen a lot of politicization here. Science is being politicized and they don't want to be a part of that. So what do you think this means then for the future of the CDC? Because if someone's coming in here, they see people, the director of the CDC ousted less than a month after she's in office or in the role, a few other people leaving after. Are they thinking, hey, if I even question the MAHA movement or RFK Jr., I'm out too? And what does that mean for this role?
I think that it really places the future of the CDC in doubt, where if the Trump administration is going to demand that the CDC director and other high level leaders in the CDC are listening to ideology rather than science, then we're just not going to get good policy. We're not going to get good responses to health crises. We already have a situation where, for reasons beyond my understanding, the CDC has cut back its monitoring of foodborne illnesses. It was regularly monitoring 8 common types of pathogens that cause food poisoning. Now it's only monitoring 2. Why? It's completely unclear as to why. But those are the kinds of decisions that you can expect if we're going to make decisions based on ideology. And I think the real question is that, Secretary Kennedy almost didn't become Health and Human Services Secretary. He almost didn't even make it out of committee. But he made promises to senators, particularly Bill Cassidy, that he was not going to mess with vaccine schedules. And I think one real question that happens, and one real tension is there anyone the president can appoint that would both listen to whatever Kennedy says, but also get confirmed by the Senate? And I think one likely possibility is that we have an acting CDC head for quite some time if Monarez is officially fired, which I would expect her to be.
And this is all coming as the FDA approved updated COVID vaccines, as well as tightened restrictions on them. What do you make of that?
Well, I don't think that it's a terrible surprise that we've restricted the COVID vaccines. This was something already alluded to by FDA earlier this year, and we saw it with the approval of the updated Moderna shot that happened a couple of months ago. I think the real issue with these restrictions, which I should probably say what they are, that COVID vaccines are generally available to anyone who's 65 years or older. You should definitely get an updated shot. There's a new variant roaming around right now that is causing more severe illness than we've seen in a while. So definitely get your shot. For adult Americans over the age of 12, basically, you do have to have a high risk condition. Although I will say that it's written broadly enough that it probably covers a good deal of the population. But where there's serious concern is that it is pretty severely restricted and going to be harder for young children under the age of 5, to get a COVID vaccine under the new guidelines. And this is a serious problem because young children, just like people who are 65 and older, children, especially children under the age of 1 year, are particularly susceptible to COVID. And we do see severe disease at a higher rate among these kids. We see more hospitalization among these kids. And to not allow a vaccine for this age group could potentially lead to more kids getting sick to the point where they have to go to the hospital, and it could lead to more deaths. And I think that is a particularly scary prospect. Now, that said, one interesting question will be that even with these FDA guidelines in place, if there's an FDA-approved drug, doctors can prescribe them off-label. So will insurance companies cover an off-label shot for kids? Because that is what the American Academy of Pediatrics, for example, recommends happens. We might see more kids getting shot, but it's a shame that we're going to have to work around official government guidelines to go with the consensus of what doctors believe should be the people getting their updated COVID shots.
I have to say, it is frightening to hear multiple leaders from the CDC saying, I can no longer work here essentially because I can't believe what's happening. I don't stand by that. And it's not good for the American people. You and I talk about, when we have our healthcare conversations, we talk a lot about the unintended consequences. What are they when it comes to this?
Well, I think obviously the major unintended consequence of casting down on vaccines, making it harder to get vaccines is the first is obvious. More people are going to get sick. Like, we're going to see more kids getting vaccine preventable diseases. We're going to see more sickness overall. We're going to see complications from these diseases. That's the most obvious and presumably unintended consequence, because I would like to think that there's not a desire to see kids get sick. But I think more broadly, though, is America has been a leader in biotechnology and in the pharmaceutical industry for decades. But if our health policy is being dictated not by the best available science, but rather by, the particular ideology of whoever's in charge, we're going to see fewer drugs maybe get tested in the United States. We're going to see pharmaceutical companies shift to other markets, Europe and Asia and Africa, rather than the United States. We may see certain lines of research just get abandoned because perhaps there's a lot of drugs that it may not be worth putting the time and resources and money into developing if you can't sell them in the United States. So there may be treatments we never see. There may be treatments that Europeans get that we don't get. There are just going to be a lot of roads not taken in order to conform, again, to a non-scientific agenda.
And I know that you said it might be a long road in getting a new CDC director, especially because it would be hard to find someone who would listen to what RFK Jr. says and also that same person get confirmed by the Senate. But specifically, what are you looking out for next when it comes to the CDC and maybe more at large, the MAHA movement?
Yeah, honestly, what I kind of expect to happen is for more of Kennedy's handpicked people to take charge in agencies across HHS. I expect more long-term career scientists to leave and be replaced with ideologues. I think that there may be some resistance in the Senate to the extent that they can be, but there are ways to work around that by having acting leaders, things like that. But I think as long as RFK is in charge of HHS, we're just going to go down a path that I think whoever succeeds him is going to have to work really hard to rebuild. It's hard for me to see a career scientist wanting to take the CDC director role or any of these leadership roles that were just abandoned, knowing that you may get fired for standing up for the facts.
Well, there's certainly a lot to look out for. And Alex, per usual, I appreciate your reporting. I appreciate you making sense of all of this news. And I'm sure we will be seeing a lot of developments soon. So I hope we can have another conversation. Alex Knapp, thanks for joining me.
Always great to be here.